This all started about October 2015. I was going to have a birthday in December, and I decided that I needed all my routine annual physical things, as in a mammogram and colonoscopy. Went through it and found out that I did have stage 3 colorectal cancer. I had my first dose of chemo on a Friday, and Friday I did great. I felt wonderful. Saturday, not so good. I had had a couple pass-out episodes in my early teens, and then when I was in early 30s. I felt fine afterwards, didn't think anything of it, and never had one through sports activities throughout growing up or having 2 children, normal deliveries, never had any issues. I said to myself, I'm going to go out for a walk before going back to work the following day. I walked probably about a half a mile up the road, and I was feeling fine. The next thing I knew, I woke up in the emergency room, and I had already had a cardiac arrest.
They shocked her 5 times between here, Fairport, and Strong. They had 3 people working on her, to save her. And for her to come out of this in the shape she is in is really amazing.
I was very lucky in it took the first responders less than 6 minutes to get to me. And so it's really important in our community to get people to learn how to do CPR, because it makes a difference in people's lives.
Her attitude toward this whole thing has been amazing. This would have crushed most people, not her. She always sees the good in everything, and anytime I complain about, I call it, suburbia problems, she says, are you going into cardiac arrest? No. Do you have cancer? No. We'll get through it one way or another.
My wish is for everybody in my age group to listen to their body, to take in diet, clean eating, lots of water, and exercise 5 to 6 days a week, 30 minutes a day. They're going to be better providers that way. They'll be around forever that way. My children are very, very supportive. It was a blow to them because they think, mothers are infallible. I'm very lucky to have them here in the area by my side.
There was a higher power at work that day. And all the good that she has done in this world, and I mean with her patients and the people around her, somebody's reached down and said, not today, not this woman. And so she's here to tell about it today.
So my why, I think, is just for the patients. I think that I've always wanted to try to, help the patients get through what they're going through, and so that they have the power to control their own life and destiny. I think that was my why.
Pre-stroke, I was a partner at a large law firm, working quite a bit, a lot of hours, enjoying what I was doing, but nonetheless hard to draw a line between personal and professional. I was working out a ton and spending time at home, but probably not as much as I should have or could have. I have 2 boys. My little guy, Brycey, was 1, and Garrett was 5 at the time. Garrett had just started kindergarten. Weeks before the stroke actually occurred, I started having pain in my right calf, and I didn't know what it was, so I presumed, given how much I was exercising, that it was a stress fracture, and the pain dissipated and went away in my calf. Probably a week post that, I then had pains in my abdomen area. The pains were sharp enough that they'd wake me up in the night, but then that too kind of went away. Then probably the following week, the pain was more in my left shoulder. And so again, didn't know what it was. So then the day before the stroke, I actually had a big meeting wherein I was speaking to a number of other attorneys, all of whom knew me. Not realizing it, I guess I was slurring my words. So it was the day before. And 2 of the attorneys laughed and said, well, I never knew Cressida had a speech impediment. I closed my eyes, and then I thought, oh my God, I'm having a stroke. And it was just as clear as a bell. I knew what was going on. And I remembered where my BlackBerry was. I got it down, and I only had the right thumb really to work with, so I hit the last dial number, and thankfully it was my sister. I had talked to her the night before.
I recognized her voice right away, but I knew something was wrong. And she said, I think something's wrong. I think I'm having a stroke. And I said, yes, you are, because I could tell by her voice.
My symptoms were so classic. I could feel the facial droop. I could feel my whole face drooping. The fact that I couldn't talk, and the fact that I had just paralysis on one side. And I got to the hospital, and I got the medicine within 3 hours, thankfully.
15 minutes after the treatment started, she said to my brother-in-law and I, look, I can move my finger.
We want to take care of our children, we want to take care of our spouse, we need to take care of our job, our profession. And you may be physically fit, and you may otherwise appear to everyone around you that you must be healthy, you look fantastic, but nonetheless what's going on the inside is very different. But it was a hard lesson to learn, because once you're on that treadmill, how do you get off? And once you set the expectation so high, you don't want to disappoint people. But then, in the end, I was disappointing everyone. So I knew I had to make a change. And I really believe in the end, by drawing those boundaries, I'm a much better attorney, I'm a much better mom, and I'm a much better wife. My why is my family. My husband and my boys are everything. And those boys needed a mother. I wasn't going to let them grow up without a mother.